Oh, on the back, yeah.
You said that your first strategy of dealing with the patient was exposure therapy, right?
Typically.
Okay, so once you've done the exposure therapy and it fails, what is your next strategy?
Okay. Make me anxious. What if my exposure therapy doesn't work? It depends why it didn't work. If it didn't work because the person didn't get anxious from the exposure, then I didn't do my job, because I have to make the person very uncomfortable. That's my job, to torture people. If it didn't work because they didn't go through with the torture exercise, then I have to understand why they didn't do that. Is it that I made it too hard? Is it that they didn't have enough resources in the background? Were they not motivated enough? Was they not clear about what was going to happen? Let's just say it's all of the above, or let's just say I got it right. Let's say I got it right, and they are motivated, and I've never actually seen a case like that, now that I'm thinking of it, where the person was fully motivated, fully on board, we actually hit the right nail, they went through it, and they were still anxious at the end. I've yet to see that actually happen. But usually if there's lacking motivation, or then you have to work on different strategies, and that's fine. Exposure therapy is my first treatment, it's not my only treatment. All right. By the way, the females, the women in the room are 4 for 4 with questions, and the men are 0 for 4. Just pointing that out. Okay, lots of people tonight are Olean. Is there a connection between anxiety and moving countries? That's a good question. One of the, many years ago, I actually wrote this woman into my book. There was a lady who came to my office. She said she's paralyzed with anxiety. So I talked to her about everything that was going on, and after about an hour and a half, I said to her, "You're not anxious." She said, "What are you talking about? I'm not anxious." First, I'm at the Center for Anxiety, so I better be anxious. Second, I'm feeling anxious, so don't you tell me that I'm not anxious. Who are you to tell me that I'm not anxious? And I said, "Trust me, you're not anxious, you're stressed." And she said, "Oh, what's that?" So I said, "Well, stress is very simple. It's when you have too many things to do and not enough time, money, resources, whatever it is. It's an imbalance between your resources and your demands. In your case, you could do exposure therapy from now until whenever. You are never going to get better. You have to do this." She's like, "Okay, well, what's this?" I'm like, "Great. Get 8 hours of sleep a night for the next 2 weeks. Start going to the gym. Go on a weekly date with your husband, and quit one of your jobs." She's like, "I can't do that." I'm like, "Great. We'll work on it next month, and get more help at your house, and stop having Shabbos guests." She said, "Are you sure this is going to make me feel better?" I said, "You have 2 weeks. Try it. You don't even have to have another session with me next week. Just do it." She came back 2 weeks later. She was fine. She was fine. We cut out all the stuff she didn't need to do, and we tried to boost her resources. So, getting back to your question, is there a connection between anxiety and moving? You tell me. Kinda. There's a connection between stress and moving, because your resources decrease and your demands increase. And once that settles, or if you have a great community like you have to support, then that can make things a lot easier. But it's probably more about stress than anxiety. What's my approach to medication? Great. Okay, so I kind of said this before, but I'll say it again. Medication can help. Firstly, there's lots of different types of medication. There are like 8 classes of medication that are used, today in psychiatry. The most commonly used medication. Do you want like a real rant here, or like the short version? It's about meds, so usually people like to hear about it. Okay, I'll rant. So, the most commonly used class of medications for anxiety is called benzodiazepines. This includes Xanax and company, Ativan, Valium. I don't know what you call them in Israel, but these are typically. What's interesting about the benzodiazepines is that they work on a neurotransmitter called GABA, and basically basically what it does is it immediately shuts down the anxiety experience. It's like an instant calm. The problem I have with benzodiazepines is that they create instant calm. And as a result, people don't end up learning to tolerate any reasonable amount of anxiety. Now, of all those benzos, Xanax is my least favorite, even though it's the most prescribed, because it has a half-life of 2 hours, which means it works right away. I prefer Klonopin, which is 12 hours, so it's a little bit slower acting. But honestly, the entire class of benzodiazepines, and if you look, they're addictive. They have a lot of propensity for addiction. So because of these factors, it's definitely not going to be something that I'm not saying it's you can't work with someone who's on them, or it's they're evil, but I do think that there's a lot better options pharmacologically. SSRIs are another one, Prozac, Zoloft, and the like. What's nice about them is that they basically don't work for 6 weeks. So you have to learn to tolerate a reasonable amount of anxiety, and even after that, they don't only act on anxiety. There's other things that are going on. So if there's an amount of complexity, it's not necessarily a bad option. But in all of these cases, then whatever, there's antipsychotics which are used, mood stabilizers, it's a whole host. Any of these options, my number one concern is that people are trying to get rid of their anxiety. Whether it's through breathing or through pharmacotherapy, it's the same problem. Anxiety is part of the human experience. We need to learn to deal with it at whatever level we can, embrace it, have it enhance our relationships, and enhance our lives, as opposed to shutting it down. So if people are using pharmacology to get your anxiety into a range that you can tolerate, and you're still pushing the upper limit of that, great. I'm okay with that. But if the intention is to wipe out your anxiety, probably what's going to happen is breakthroughs, which means I start taking pills, I feel a little bit less anxious right now, but I'm actually becoming more sensitized to my anxiety, which means the next time I feel anxious, I need to take more. And then I take more, and then I have to change to something else. And in addition to the addiction propensity, the addiction vulnerability, you're also basically trying to chase a holy grail that you'll never get to, because we can't have anxiety-free lives. So that's the intention of medication use. It really matters what's your kavana. If your intention is to be anxiety-free and that's why you're taking meds, I'm not a fan of it at all, no matter what you're taking. If your intention is to get into a reasonable range so you can do what you got to do and push the limits of your anxiety, then we have what to talk about. Okay, that's my rant. Yeah.
Just on that topic, I'm not sure how it works here in Israel, but in Chutz La'aretz, there are family doctors who will just straight away put patients on medication. From what you're saying, as a psychiatrist, what would be your feeling on that? Do you think that it's
What's my take on a family doctor who
malpractice?
Yeah, I don't know malpractice.
Not malpractice,
I don't know about malpractice, so I'll give you two answers. Number one is 1 in 10 physician visits in the United States today results in the prescription of an antidepressant medication, which means it's basically being prescribed like vitamins. Okay, these are not vitamins. Two is I actually had an op-ed, an opinion editorial in the Wall Street Journal this last weekend on Shabbat, which was about a new policy which was recommended by the Health and Human Services. It's the U.S. Preventive Task Force of Health and Human Services, which advised that all PCPs, all primary care physicians, all family doctors, screen for anxiety using this measure of how intense people's anxiety is. And the whole thing is a whole setup. It's a recipe for disaster, because people are going to come in, everyone's going to have high anxiety, and Xanax prescriptions are going to be the number one thing. So I wrote there that we've done this before with the opiate epidemic. We did this with ADHD, and Ritalin went through the roof. And here now we're doing it again with benzos. So I think, I don't know if I would call it malpractice, because there's no malfeasance, if people aren't intentionally doing something wrong, they're really following guidelines, I'd be very cautious. For sure, get a psych consult if you have a concern about meds. If you can't afford it, fine, then your Kuprat might be the way to go. Okay, do what you can. But I would for sure, if you're considering any significant medication, I would definitely get a consultation with a psychiatrist. All right, should I keep going? A couple more. I'll try to see if I can consolidate these into 2 or 3. Would I encourage someone to lean towards their panic attacks by actually having one. Yeah, absolutely. If you have not had a panic attack yet, try to have one next week. It's uncomfortable, you'll want to die, but you won't die, and it'll just be, a very unpleasant experience that should be over within 10 minutes or so, and you'll be a lot more resilient for it. How do you get a close relative to open up about their anxiety? Yeah, that's a great question. If they won't, so anybody who won't open up about their anxiety, crying is that's gonna get their adrenaline to go worse. So you usually have to settle things down for them. It depends on how defensive they are. If they won't even talk about it, or look at you, or they're completely avoidant, there's not a whole lot you can do, aside from maybe modeling, say, hey, I was really anxious the other day and I decided to talk to a therapist.
What about trying empathy?
You could, that doesn't always help.
Just as a start.
Yeah, also I am also assuming that if the person's close relative is not opening up to them about their anxiety, then that's a skills deficit on the person's part. So yeah, you can try to talk about your own feelings, see if they take the bait. And also wait. Usually anxiety will get really bad at some point if you don't deal with it. So at some point you might just have to wait it out. Not fun. Okay, what are the worst things, worst and better things that you can say to someone who has anxiety? Good question. And don't say get over it. Don't be such a baby.
Have you tried yoga?
Have you tried yoga? That's a good one. Try deep breathing, right? Suggestions. What things could you say? I think empathy is probably going to be the right card. That must be really hard for you. I understand. These are real feelings. This is not. I might see how they respond to something like, I would maybe talk about how common anxiety is. Are you aware that a fifth of America has anxiety disorder? Even here, it's 7%, 6% is still very substantial. So it's still substantial, more than 1 in 20 Israelis. So to know that people are not alone. I would also read up about anxiety yourself. Try to think about which messages might resonate with the person. Often when people feel this anxious or they have loved ones who feel this way, they sort of will avoid the topic. I don't want to think about it. They engage in cognitive avoidance. That's obviously not helpful. Okay, similar question. Having a child who has anxiety, it doesn't want to go to therapy. I don't blame your kid for not wanting to go to therapy. It's something's wrong with me, I gotta talk to my therapist. It's annoying. Bibliotherapy can be good, giving them books which are on the subject. There's some great ones on Amazon, that are very well. If you Google kids anxiety books on Amazon, you'll see 4 or 5 that are in the top. There's several that have been read that offer similar approaches to what I'm saying. Also, talking about your own discomfort can help a kid to open up. Self-disclosure is a very powerful tool to be able to get people to speak about their feelings. Okay, and finally, should you speak to a professional even if you're convinced that they won't be able to provide you good advice? Trying to tell me something?
See me afterwards.
Probably.
See you afterwards.
I don't know why you're convinced of that, so it's a little bit hard to say. If you've been to someone, and I'll put it this way, if you're going to therapy and it's been 3 months and you're not making a lot of progress, it might be it's definitely worth having a conversation with your therapist about, hey, I don't really feel like I'm getting what I need. Can we talk about that? And it might be worth looking for something else. But I guess that's the answer to the question. If it's more than 3 months, then probably not. And if it's less, then keep going. All right, thank you very much.